Thank you for the invitation. We are going to talk about the topic challenges from AIDS-related comorbidities in China and the management strategies. As we all know, at present, ART is the most effective means to control HIV infection. The long-term antiviral effective rate could reach more than 90%. However, in the ART era, people living with HIV is facing many new challenges, including drug comorbidities, adverse events, and aging, polypills taking, and comorbidities, especially AIDS-related comorbidities, which have increasingly become the focus of attention. As life expectancy for people living with HIV has improved, the number of other people living with HIV has increased really a lot. Based on the latest UNAIDS estimates in 2018, more than 20% of people living with HIV globally were aged over 50 years old. And this is projected to rise to 73% by 2030. Long-term effects, including side effects of ART, are the primary concern for people living with HIV. In a study, 67% of people with HIV worry about the long-term effects of HIV treatments. In 2019, a cross-sectional study of people living with HIV receiving ART across 24 countries was held. The proportion of patients with more than one comorbidity in all age is 58%, but if the patient is over 50 years old, the proportion will increase to 83%, with which has more than one comorbidity. There are many reasons about this phenomenon. The most important one is that HIV and ART can exacerbate the aging process and have both been associated with persistent inflammation leading to immunosenescence and the development of age-related comorbidities. There are quite a few comorbidities observed in people living with HIV. The most ones are shown on this slide. You can see that pulmonary disease and glucose, liver disease, cancer, and cardiovascular disease, kidney disease, and both these diseases. All these diseases should be monitored closely, especially for older individuals. Firstly, let us focus on the liver disease. Liver disease has emerged as a major reason of comorbidity and mortality in people living with HIV. How about the association between the duration of ART and the liver damage in HIV-infected patients with a normal baseline liver function and without HBV or HCV infection? A retrospective study was conducted in these patients in Guangzhou City, Guangxi, China. Among nearly 2,200 eligible patients, 12% of patients developed liver damage. We here use a grade 2 to 4 Li or TBE index and contributed 4.1 per 100 years crude incidence rate. And we can see that the highest liver damage incidence was observed in patients within 6 to 12 months after ART. Then the incidence decreased and maintained at a relatively low and stable level in patients after ART over 2 years. Another retrospective cohort study of HIV-infected patients receiving ART was held in Taizhou, Zhejiang, China. That's a totally 955 HIV-infected patients were included. Among these patients, 85% are HIV monoinfection, 16% with HBV or HCV co-infection, and the median duration of ART was 15 months. For these patients, 37% had over 30% decrease in FIB4 index, and 15% had over 30% increase in FIB4 index, and the remaining 48% patients had stabilized FIB4 index. So in this study, we can see that the improvement of liver fibrosis factors, including that's the older age, but the positive with baseline FIB4 index and over 30% increase in CD4 cell count up to ART. This study indicates that improvement of liver fibrosis could be achieved by early initiation of ART through better CD4 cell count recovery. For people living with HIV, with increased ALT and or AST, we could manage them step by step as follows. This is the steps if we have the patients with higher ALT or AST, and we can follow the step by step to manage how to treat with the disease. Is associated bowel or kidney disease is another concern of people living with HIV in ART era. Both HIV infection and ART treatment increase the risk of bowel and kidney disease in people living with HIV compared to HIV-negative people. So we can see that the incidence of osteoporosis and osteopenia in people living with HIV receiving ART is approximately 3 times higher than HIV-infected patients. And people living with HIV had a higher risk of chronic kidney disease compared to general population. And the estimated prevalence of CKD for people living with HIV ranges from 2.5% in Europe to 7.4% in North America. After ART initiation, people living with HIV could develop kidney problems and decreased in bone mineral density in varying degrees, especially those patients using TDF given with a PK booster. Some studies held in China has revealed HIV positive patients may face a high proportion of metabolic bowel disease. The first study we can see here compare BMD between HIV-infected Chinese patients and healthy HIV-negative healthy male controls. We can see that more than 50% of patients had decreased BMD and osteopenia, much higher than the healthy controls. Another study was conducted among 156 ART-naive HIV-infected patients in Beijing. There were 49% developed osteopenia and 4.3% developed osteoporosis. And the low BMI is a risk factor for low BMD. So it's very important to closely monitor the BMD in ART-naive patients. And the third study retrospectively analyzed 122 patients in a HIV clinic in Beijing. A greater bowel BMD loss was observed in patients treated with TDF over 96 weeks, compared with those on non-TDF containing regimens. The use of ART has different impact on the renal function of people living with HIV. There was a survey of more than 5,000 HIV-infected patients on ART. And we can see that 2.3% progressed to chronic kidney disease, 20% with normal baseline renal function progressed to moderate renal impairment, but 74% with baseline renal impairment improved to normal renal function. And kidney disease after ART was significantly associated with older age, lower baseline EGFR, and TDF, and enhanced lopinavir use. Of a Chinese real-world study, 67 HIV-infected patients were enrolled in Guangzhou AIDS People's Hospital, including 14 treatment-naive patients and 53 treatment-experienced patients. The most common reason for them to initiate or switch to DTG plus 3T regimen was renal dysfunction. And we can see that 82% treatment experienced patients and 98% pretreated patients achieve virological suppression at week 48 after the ART. Among 35 patients with renal dysfunction at baseline, 12 patients had the dose of 3TC adjusted, but the renal function remained stable during the simplified regimen treatment, regardless EGFR or 3TC dose adjustment. The DHHS guideline recommended to identify the risk factors of bowel disease, screening and diagnose bowel disease with DEXA, MRI, or other methods. For kidney disease, it's also very important to check the risk factors for CKD, diagnose and treat with them early. Cardiovascular disease is a fatal disease for people living with HIV. Some ARVs can cause the heart damage. For example, the PI and APACC. Lifestyle factors such as smoking and overweight can also affect CV risk. Several important guidelines have pointed out that people living with HIV are facing weight gain, dyslipidemia, abnormal blood glucose metabolism, insulin resistance, and metabolic syndrome. And some ARVs, for example, AZT, efavirenz, lopinavir, TAF, could lead to some metabolic abnormalities. It's noted that the increased levels of TC and LDL-c are associated with increased incidence of heart disease, but high HDL-c is a protective factor. HIV infection and the treatment may increase the risk of dyslipidemia in people living with HIV. The first line therapy for dyslipidemia is lifestyle change. For instance, improving diet, increasing exercises. If no effect, we can use lipid-lowering medicine. Compared with HIV-negative people living with HIV have higher myocardial infarction incidence by age. We can see the instance. No matter less than 40 years old or over 60 years old. For HIV-infected patients, being over 60 years old could increase the risk of MI by 2 times, and the diabetes could increase the risk of MI by 1.5 times. A study was held in Shenzhen aiming to understand the prevalence and the high-risk factors of dyslipidemia in treatment-naive HIV-infected patients. A total of 1,195 adult ART treatment-naive HIV-infected patients were included in this study. And we can see that the prevalence of dyslipidemia in these patients is very high, and the risk factors could include traditional factors such as older age, overweight, obesity, low CD4 and CD8 ratio, and high HIV RNA low. For HIV-infected patients with high and very high patients, we have to see what caused the risk factors. And another multicenter cross-sectional study, 1,518 treatment-naive patients, HIV-positive patients, and 347 HIV-negative people were recruited to observe their blood lipids. The average the age is 38 years old, and over 80% is HAM. The blood lipid indexes, including TC, TG, LDL, and HDL, we can see that show a consistent upward trend, but HIV infection is an independent risk factor for dyslipidemia. For HIV-infected patients with high and very high CVD risk, we have to treat with them, decreasing the LDL-c to less than 1.8 and 1.4 millimoles per liter. In order to prevent cardiovascular disease, we could assess the CVD risk within the next 10 years. Suggest patients to go on a diet-changing lifestyle, consider to modify ART regimen. If the patients had CVD risk more than 10%, at the same time, we needed to identify the key modifiable risk factors, including blood pressure, coagulation, glucose, and the lipids, and treat with them to reaching the target index. As a crucial simplified regimen without a second NRTI, DTG plus 3TC has demonstrated small changes in weight over time and the low impact on the markers of metabolic, renal, and the bone health in these very famous studies, including Gemini 1, 2, Tango, and the SASA. And that's the summary. In the era of ART, people living with HIV face increasing AIDS-related comorbidities. The main AIDS-related comorbidities in China are hepatic, renal, bone, and cardiovascular disease. It's very, very important to screen early intervention and treat with AIDS-related comorbidities before ART initiation and during ART course. There are many ways to prevent and improve HIV comorbidities. One of them is to change ART regimen, including switching to a simplified regimen without the second NRTI. Mostly used is that DTG plus 3TC. That's a very, very important way to help prevent or improve HIV comorbidities. That's all for today. Yeah, thank you for your attention.